You're going to turn on your right side so you're facing me. So this side, slide back a little bit. Remember this knee over here. Now, an AP knee, or I'm sorry, lateral knee, it would be kind of like this. For a lateral femur, okay, what we're trying to do is get this tissue out of the way. So what we're going to do is we're going to bring this knee up towards his chest as high as you can here, okay? As much as your patient can do. Okay? By putting the sponge over here, that'll keep his hips from collapsing down and having an over-rotated film. So this one will be the lateral distal femur, okay? Because our lateral proximal femur is what? Our hip film, okay? Just our frog leg hip that we've been doing, okay? So with this one, now we can use the big film for the knee going up, okay? When an AP is the opposite, okay? So you need to remember on your AP film, it's big film, little film, okay? When we're doing the lateral, it's little film, the hip, and then a big film from the bottom up, okay? So this one would be a 14 by 17. So what we're going to do is we're going to bend the knee a little bit just to make it easier to see where the femur ends. Okay? The legs straight out all looks like one big thick body part here. It's a little bit harder to tell. What we're going to do is find the knee. Okay. I feel just below that, below the kneecap. Okay? Because if you look at the films on our lateral film, usually the kneecap and the lower condyle kind of correlate towards each other. So if you have the entire kneecap on there, you're good. This thing needs to be adjusted to his femur, which is this way. So we can adjust this in a little bit. Okay, generally you're going to have some light field on the opposite side. Okay, if they can't get their leg up quite as high. In that case, I would just bring it down a little bit with the collimation and then just recenter down a little bit. Because you're not going to see anything with this tissue here in the way. Along the side here, okay? Protect the reproductive organs as much as possible. If you're having life hit this, you probably need to either move your shield just a little bit or collimate down a little bit further on that. Okay? And you can shield like this on males and females. Okay? The organs are going to be up towards the superior side. All right, marker. Make sure he's not collapsing too far either way. And again, keep some lateral on there. Questions? Lateral distal femur. Okay. Lateral distal femur, make sure you use a big film on this. Okay. And it'll say lateral distal right or left femur on there. Okay. As long as you use a 14 by 17, go from the knee up as high as it'll go to the 17 inches, you'll be fine. Okay. You're just going to collimate side to side. Make sure you turn the tube head so it's going along the line of this femur. Okay. And this femur is clearly going like this. If you turn it like this, then you're going to be clipping pertinent anatomy. Okay, so that's let's see, AP pelvis, frog leg hip, lateral distal femur, and AP proximal femur. Okay, so 4 positions for that. The other positions are kind of overlap. The frog leg overlaps with the lateral, the knee overlaps with the AP distal femur as well. Okay? So even though we're doing 4 positions, you're going to be putting some of the other things that you know together with this exam.